And now we want to get right into this really important topic here about Black women and pregnancy. Federal statistics show Black women are 3 times more likely to die from a pregnancy-related cause than white women. Why this discrepancy? A local organization called For the Village working to improve Black infant and maternal health outcomes. And we have the executive director, the founder and doula, Sabia Wade, joining us now. Good morning to you, Sabia.
Good morning.
And you're with For the Village. You founded this great organization here in town. We're so lucky that you're here doing the work that you do because this is pretty shocking to hear about these disparities, racial disparities for Black pregnant women. Why is this happening?
So research shows that there's been all different types of studies. There's been studies about, is it the socioeconomic status? Is it access to healthcare? What is it? And through research, it's shown that only racism and discrimination are the factors to why this continues to happen.
Racism and discrimination are the reasons.
Yeah.
This obviously is something pretty disappointing in our system that we want to try to fix. So let's talk about that. How do we get people the care they need? What needs to happen, in your opinion, to change all of this?
Yes, so I think there's many different things. I think one is that everyone has to realize that reproductive health affects everyone. So the first thing that I would say is start learning in your personal journey about reproductive health, reproductive justice, what this means for your family. If you want to learn somewhere, you can definitely utilize my book, Birth and Liberation, and we talk about history, the future, and where we want to go. And the next thing is getting involved with your community. So we'll talk about this, but getting involved with For the Village, getting involved with even understanding what's going on in your community, and finding spaces where you can provide services, donations, any of that to help out your community.
And you're doing a lot of great work with For the Village. You're the founder of it, obviously. You saw there was an important need here. Tell us what programs you offer, how people can get help through you.
Yeah, so For the Village started in 2018, and it started because I was like, we need a community-based doula program in San Diego. So since then, we provide birth support, we provide postpartum support, so at least 12 hours of postpartum support after someone has a baby. We provide a lactation program where we have an IBCLC that can come out and help our clients. We provide education around lactation, childbirth education. We also provide support groups, and we have many other ways in the community where we try to connect people and get everyone connected to what they need, including things like housing, food insecurity, and other issues that may be happening with our families.
Yeah, because if you are going through, obviously, a low income, I mean, then to have a baby on top of that, there's already so much piling up on you. You would think the lactation services, the postpartum care, all of that would be something easy to access. It's so important that women who have these babies get that care, but it's not, right?
It's not very easy to access, and I think the other layer that we have to be aware of is also barriers to care. One, access to healthcare, but also does the lactation provider or provider speak your language, right? Can they meet you where you are? Do you have the ability to get to the hospital? Do you have the ability to get to an office, right? So those are all things that we look at, not just the idea of you getting these services, but also how do you get there? Do they speak your language? Do they understand your life? Right, so culturally competent care is the care that we aim to provide.
Right, yeah, you could be living in the South Bay and there's a service in Vista, and that's not going to work for somebody who doesn't have time to make all of that work. So tell me, the people that you are able to help, Sabia, if someone's watching right now who is maybe pregnant or wants to be, but doesn't know how to even go through all of this, how can they get that help?
Yes, so we say go to our website, forthevillage.org, and start there. From there, you can send us an email. We also have our number up there. You can send us a text. And then for the people who are looking to say, like, well, do I qualify? We always say if you're pregnant, no matter if you are 2 weeks pregnant or 41 weeks pregnant, or if you're actually in labor, you can call us and we will get somebody there.
It's amazing. You can tell, obviously, you care about these families, and you will continue to do that care. It's important work you're doing, Sabia. Thank you so much for being on with us and obviously bringing attention to this. I think the knowledge behind all of this is so important that you're sharing in San Diego. We're lucky to have you.
Thank you so much.
Forthevillage.org is the place to go to even learn how to help out as well. We'll be right back after this quick break.